Well, good morning, everyone. For those of you that I have not had an opportunity to meet, I am Michelle Smith. I am the Director of Workforce and Team Member Development for Advocate Health. And so April and I have had many discussions about our steering committee. And so I will be serving as the chair of the steering committee moving forward. So welcome, everybody. It's great to see you all on this, wintry December day. So we can move on to the next slide. All right, so I think most of us are familiar with CHWC, but we are an employer-led sector partnership comprised of 13 of Chicagoland's major hospitals and health systems. We are supported by a large network of strategic partners, and those include training providers, workforce development organizations, funders, researchers, and other collaborative organizations. And so our mission is, as the Chicagoland Healthcare Workforce Collaborative unites employers and industry partners to support an inclusive healthcare workforce, provide accessibility for employed, unemployed, and underemployed populations, and develop innovative responses to the evolving needs of the healthcare industry. And so you also see on this slide, our strategic pillars include local and targeted hiring, education and training, and retention and career paths. So I'll go over our agenda for today. So you can see we'll have, we'll go through the 2023 calendar. And so we'll also hear about the Youth Pathways Committee, their recent healthcare opportunity showcase. April will update us on our progress with the Good Jobs Challenge grant and present some initial ideas for pathway programs to pursue with that funding. And we'll also get introduced to two organizations we're partnering with on that grant. So the Health and Medicine Policy Research Center and I Am Abel. OAI will talk about a program proposal they're building in response to the Department of Labor's Nursing Expansion Grant. So there are opportunities to join their project to train and upskill nurses. The Healthcare Council of Chicago, or HC3, will talk about their Future of Work series that launched yesterday. I actually participated on the panel yesterday with a young lady from an organization called Alight. And so we really just kind of talked about, coming off of the heels of the pandemic, how I was a representative from a healthcare organization, how Advocate Health has transitioned and how we're doing business differently, how we're looking at the future of work as a result of having gone through the pandemic and what's on the horizon for us. And then the young lady from Alight, that is a consulting firm. And so she gave a perspective from the industries that her organization works with as it relates to those similar topics about, what they're experiencing as a result of COVID and coming out of the pandemic. And then at the end, there'll be an opportunity for all of us to share announcements and give an update related to your organization. And so lastly, just the calendar notes. So April will be sending out calendar invites for the quarterly dates shortly so that we all have them. We intend to keep these meetings on Tuesdays via Zoom from 8:30 to 10, with the exception of the meeting in June. So in June, we are considering moving that meeting to in-person and pairing it with a networking opportunity. So you'll see a poll that pops up. I think it's popped up now. So just take a moment to answer the question as to whether or not you would be interested in participating in that meeting in June in person. And then very last thing is that I'll mention is that we plan to launch a Lunch and Learn series next year. And we'll be looking to set the schedule soon. So we're hoping that each of you would want to participate in a Lunch and Learn series and present on a particular topic so that we can all just continue to share best practices, but doing it in a little bit of a different format.
Thank you, Michelle. I think we have almost everyone on here has participated in the poll, so I'll end it so you can all see. I think we all want to meet in person, which is great. And a lot of us are leaning towards breakfast. So that looks like probably what we will do in June. I hope to build out some more space for conversations. I think that's pretty difficult to do over Zoom sometimes. So hopefully we'll try and shorten our updates during that meeting and have more time for, possibly breakout rooms with some critical conversations, but should be great to see everybody in person. No one voted no, so that's great. We're definitely doing it. And I will send out those Zoom links for the other 3 quarterlies shortly. With that, I'll pass it over to Lindsay to give us an update on the Youth Pathways Committee.
Awesome. Well, good morning, everyone. I'm Lindsay Reams. I'm part of the talent acquisition professional team here at Northwestern Medicine. Let's see a little bit about the Youth Pathways Committee. It is comprised of people at hospitals and community organizations who work on healthcare career awareness programs with high school students, college students, and young adults. So if you are one of those people, please contact April to join. That would be amazing. We created a searchable youth pathways directory on the CHWC website with 32 internship, mentorship, volunteer, and other enrichment programs that are currently listed. It helps facilitate cross referrals and spread awareness to students. And we are also currently working with CPS on strategies to strengthen healthcare career awareness programs in 2023. We recently had our College Healthcare Opportunities Showcase, our second annual one, was designed to expose young adults and students enrolled in post-secondary programs to internship, mentorship, and volunteer opportunities with Chicago's major healthcare systems. Students were able to learn about programs by visiting 8 virtual exhibitor booths. The event also featured 5 job spotlight sessions where professionals working on in-demand, sometimes lesser known roles in healthcare were interviewed about their day-to-day job and the path they took to get there. At the showcase, we had 177 students registered. We had over 100 views at our info session booths at our most popular booth. 73% of survey respondents found a program that they intend to apply to, which is amazing. 100% of our survey respondents rated the event either excellent or very good. So it was a great success. So does anybody have any questions regarding, being part of the committee or, kind of what else we do to get our name out there? Feel free to reach out to April too, if you do.
Thank you, Lindsay, and thank you to everyone. I know there are several people on here who worked hard on that event. I thank you all. I would love to just keep growing what we're doing here, get more employers involved, more organizations. So if there's anyone on this call who knows of a program that is geared towards college students, but also high school students, or even middle school, we focus on all, youth age groups in this committee. If you know of a program that isn't involved with the Youth Pathways Committee yet, please connect me with them. I would love to chat and see if they're a good fit for our group. Moving on to the Good Jobs Challenge Grant. So as many of you know, we were part of a successful grant application to the Good Jobs Challenge in Chicago. This is an opportunity out of the U.S. Economic Development Administration, and its goal is to provide access to high quality jobs that include good pay and benefits and career mobility. The Chicago Cook Workforce Partnership is the lead grantee on our application. We are one of 4 sectors that the application focuses on. It's a 3-year grant that goes through August of 2025. But I believe that we have time even beyond August of 2025 to expend funds and report on outcomes. So there's a long timeline here. The total grant that we were awarded is $18.5 million. $2.5 million of that is designated for healthcare. A lot of that will go through CHWC. Some of it will also go to the Public Health Workforce Collaborative And very shortly, we're going to learn more about the backbone organization in healthcare that was named on this grant, which is the Health and Medicine Policy Research Group. They currently host the Public Health Workforce Collaborative, and we are currently figuring out how CHWC will better align with HMPRG through this grant in the future. So this gives you an idea as to the full grant application in Chicago. Like I mentioned, the Chicago Workforce Partnership is our lead entity. We're focused on 4 different sector partnerships. Healthcare is one of the ones that is furthest along the path. We already have our sector partnership, but new ones are being built in information technology and in TDL. And manufacturing, there is a sector partnership in the Calumet area, but they are expanding that to reach more of Chicago. And the grant is also supported by some other organizations, the Network of Employer-Led Workforce Solutions, which is a table that I participate on, where I get to talk to the folks who are leading these other sector partnerships, and we get to share resources, and News will be supporting us with best practices throughout this process. LISC Chicago and Women Employed will also be supporting participants, and World Business Chicago, which is the mayor's workforce development arm, is also at the table. So as I mentioned, we are far along in this process as the Chicagoland Healthcare Workforce Collaborative. This entire grant by the EDA was focused on sector partnerships, and it recognized that they may not exist in many places, or they may not exist in certain industries. So the first phase of the grant program is system development, and that's creating your sector partnership, convening your partners, defining your goals. And we have already done that. Because we are here today. We are CHWC. We have all of you on board. We are meeting on a regular basis. We have a strategic plan and a steering committee, so we can check that box off. Right now, we are in phase 2, which is program design. And what that entails, and I'll talk more about this in a few minutes, is deciding which pathway programs we're going to target our money towards. Once we've honed in on some of those, we'll hire additional staff or consultants to design those programs, to run those programs, to do that work of really figuring out all of the fine details, recruiting partners, establishing MOUs, etc. And we'll have to submit a more detailed budget and scope to the EDA to move forward with that. I'm hoping that we can finish that work in the first quarter of 2023. And that we can move on to program implementation either in Q1, perhaps Q3 of 2023. And obviously that is where we implement these pathway programs. We'll be tracking outcomes, hopefully, course correcting as necessary. And at the same time that we're running those pathway programs, we'll be focused on building the long-term sustainability of CHWC and its other activities, such as the Youth Pathways Committee or our research with our career pathway mapping project, etc. I am attending the launch of the community of practice around this grant next week in DC. So I hope to come home with some more specific details around the timeline and the budget to bring home to our steering committee and eventually to this whole collaborative over the next couple of months. But what I wanted to do first was allow you all, if you don't know them already, to hear a little bit more about the Health and Medicine Policy Research Group and what they do and their role with the Public Health Workforce Collaborative, since we will be aligned so closely with them on this project. So I will stop sharing. Margie, I think I gave you permission to share. Margie Schaps is the Executive Director of Health and Medicine Policy Research Group. I'll hand it over to her. And you are still muted, Margie, I think.
Okay, sorry about that. April, can you pull it up for me? I'm not finding it.
Oh, okay. Let me grab it from my email. Why don't you just go ahead and start talking and
Sure.
I'll find it.
Sure. Hi, everybody. Sorry about that. I disappeared for a moment. It's nice to see some old friends and meet some new folks. And I've already learned a lot. And Lindsay, I know that I'll want to connect with you based on the presentation you just made. So for those of you who don't know me, and I apologize, I have a bad cold, and so I will try not to cough too much in all of your ears. I'm the executive director at Health and Medicine Policy Research Group. We are a 40-plus-year-old policy and action think tank in Chicago focused on public health and health in based in Chicago, but our work really focuses across the state of Illinois. And thanks so much. I appreciate this. So maybe go to the next one. Now I can't control it. Sorry. So appreciate that. Okay, so we work on a lot of different issues, public health and healthcare, ranging from long-term care reform to childhood adversity. I work with some of you on various ones of these different projects. Public health systems, supporting the Cook County and other public systems, to Medicaid reform, and of course to workforce, which is why we're here today. But just to give you a sense of the breadth of health and medicine, those are some of the kinds of work that we do. And of course, they all have a workforce component. And so we started our workforce work in the mid-1990s. We can go to the next slide, please, April. Thank you. So the ways in which health and medicine works, we develop legislation, city, county, and state level. We build a lot of different coalitions, which I'll talk about more in a minute. We do a fair amount of research and publish papers, and develop policy again at the city, county, state level, work with governmental bodies, healthcare providers, meaning FQHCs, free clinics, hospitals, and community-based organizations in the coalition work that we do. We put on a lot of educational forums on various topics over the last year or two. We've done several virtual forums on the impact of COVID-19 on our health systems, on community-based organizations, on the public health system. And at these, I mean, one of the tiny silver linings of the last couple of years is that these virtual forums we can have 300 people at, and historically we do these in person, and sometimes we'll have 50 to 200 people, but we have been getting people from all over the country at our education forums, and all this is available on our website if anybody wants to look further. And then systems reform, a lot of work in particular on health systems and public systems. We work a lot with Chicago Department of Public Health and the Cook County Department of Public Health, and sometimes with hospitals. Certainly we have a hospital collaborative that works with our childhood adversity collaborative. So let's go to the next slide. We can dig into workforce. Okay, so we have several different workforce initiatives. Some of you may actually connect with us on our Schweitzer program, Schweitzer Fellowship Program. We are one of 14 sites around the country that accepts 30 post-college, so graduate level health professional students. So they could be medical students, nursing students, occupational therapy, social work, psychology, any health or public health program. They can apply to become a Schweitzer Fellow. We connect these 30 folks. We usually get about 100 or 125 applications. We select 30 people for a year-long cohort program where they work with a community-based organization to develop a project in that community. And these vary enormously. I mean, it can be from a food insecurity program to an HIV with kids program to an older adults literacy, health literacy program. These vary quite a bit, but they are a cohort that we are trying to help instill the values of working with underserved and marginalized communities. We've been doing this for 26 years, so we have about 750 graduates. There are many thousands of Schweitzer Fellows all over the country. The mother load is based at Harvard in Boston, but there are 14 of us. So that's our Schweitzer program. We have our AHEC program, Area Health Education Center, which is a program of HRSA at HHS. And some of you are probably familiar with the AHEC program. Every state gets an AHEC grant from HRSA. These grants go to universities only. So in Illinois, the grant goes to the University of Illinois. And we are a sub-grantee. In Illinois, we have 8 sub-grantees. We are one of 2 Chicago-based sub-grantees. The purpose, the role of AHEC is to foster the next generation of a diverse health and public health workforce. So here's where I thought about connecting with you, Lindsay. We do a lot with Chicago Public Schools. We have a program called AHEC Scholars, where we take post high school, so community college, college level, and graduate level folks who want to learn more about public health, and we have modules to teach them and place them in various settings to learn more about health and public health as they make decisions about the professions that they want to work in. And then this past year, and just pre-COVID, I mean, literally a week before COVID shut down, we hosted a program called Black Men in White Coats, which is based out of Texas. And we've been the Illinois expression of the Black Men in White Coats, and we hope to do it again next spring. We've had over 500 people register for this program. It's students, mostly CPS, but not exclusively, students, parents, and teachers. And Dr. Conway, who you're going to hear from, has been a participant on our advisory committee for Black Men in White Coats. And it's an exciting opportunity for youth to be exposed to to medicine. GWEP, that's the Geriatric Workforce Enhancement Program, RUSH. I'm not sure if anybody on this line is from RUSH, but we work closely with RUSH on this GWEP, again, a national funded program to support geriatric workforce enhancement. As everybody knows, we're really short of, in this country, we have an enormous shortage of folks working in geriatrics. And we're working closely to do active listening training and development of modules to support the workforce, particularly family and caregiver workforce. We've been instrumental with lots of other people in developing the CHW model in Illinois and passing legislation, first under the Quinn administration and more recently under the Pritzker administration, to move forward reimbursement and certification of community health workers. We are the backbone organization, along with Sinai Urban Health Institute, for several different community health worker initiatives in the western suburbs, and with the Cook County Department of Public Health through several CDC grants. So we are deep into community health worker work, and we have been for about 20 years now, and are loving that we're seeing so many organizations really realize what the value of community health workers and how they can enhance your programs and enhance the public's health at all different levels. So in 2020, some of you may know Matt Bruce from the Workforce Partnership, Funders Partnership. Matt Bruce approached us, knowing our history on working on community health worker work, and asked if we might be interested in developing a table, a collaborative like this, a collaborative of public health folks, because we did a lot of work on developing the contact tracing model with, I saw Rhonda is on here, and lots of other folks, Chicago Department of Public Health. So we had a history of understanding the contact tracing and the relationship to community health workers. And so we were tapped to develop a public health workforce collaborative. So we did that in 2020. We have 20 or 21 members of that. So, and there is such a strong relationship in my mind between what you all are doing and what the Public Health Workforce Collaborative does. And I know that folks at the hospital table, there's a lot of work that you do that is public health work. And some of the members at the Public Health Workforce Collaborative are hospital members and other healthcare providers. So at that table sits the local public health department, CDPH, and the Cook County Department of Public Health, many community-based organizations, behavioral health providers, older adult health providers, violence interrupter organizations. So it's a really broad swath of public health groups. And those groups were very productive during the last couple of years. But what emerged over, I'd say, within the last year, what really emerged was a deeper interest in digging into, yes, we want to look at all public health careers and advancing sustainability of a growing public health workforce, but also what emerged was a deeper interest in figuring out how to strengthen community health worker pathways and the workforce of community health workers and options for community health workers to develop their careers should they want to. Many community health workers want to stay working as community health workers, and that's great. So to that, and at the same time, as I'm sure many of you are aware, the Department of Healthcare and Family Services was releasing a fairly large grants for health transformation systems. And I know many of you are part of those grants, and several of the Chicago area grantees were focused on community health workers. And for some of them, not all, but for some of them, this was new territory. And what we were hearing was a real interest in developing another collaborative that was focused on CHW initiatives, where folks who were either new to the CHW arena or folks who are really steeped in it, but wanted to share and learn from other people could come together. So that group's only been meeting for about a year now, and it's been really productive. And that will be the kind of center of gravity in terms of the Good Jobs Grant for the health and medicine piece, will be the building out more of the CHW pathway. And we are not as far along as this group is, and I really applaud all the work that you guys have done. So we're not quite as far along, and it's not entirely clear where we're headed, except that we know that CHW is the center of gravity there. We'll be working closely with April, because I know CHWs are really important to some of the work that you all do. And I think that I'm pretty excited about the potential for collaboration of these two groups. And so that's really health and medicine. I hope I didn't take too long, April, and please reach out to me if you want to talk more about this.
No, that was great, Margie. I'm super excited for us to work more closely as well. Does anyone have questions for Margie before we move on? Well, and I will include her slides, all the slides that will be presented today. I will send out in a newsletter later this week with a recording of this, so you can take a look and follow up with folks as you wish. I will move on then. Oops, get rid of the PowerPoint. To talk about the pathway programs that we are currently looking at. So some of you might remember that over the last several months, at our last quarterly meeting, we had some discussion around, where to focus our efforts. Prior to that, I had put out a survey to our employer partners asking you to identify, which five occupations do you have the largest number of vacancies for? And also, which occupations do you have the highest turnover rates in? We saw that everyone, and this probably is of no surprise to anyone here, that everyone referenced nurse as their number one, if not number two, occupation for which they have the most vacancies, and the nursing assistant, whether you call that a certified nursing assistant or something else at your system, was also on that list. Many of you also included medical assistants. And so we decided that it would be prudent to focus at least some of our money on progressive pathways in nursing. And so let me share my screen again. I have honed in on 3 different programs so far to focus our Good Jobs Challenge money. And I will say that this is all in draft mode. We are in brainstorm session right now. So this is a draft. We have more conversations to have on these 3 different programs. And the reason I'm sharing it with you all today is I welcome your feedback. I welcome you, anything that I talk about today, if you're like, I have thoughts on that, I think it's a great idea and I think you should do this, or I think it's a terrible idea and she needs to know why, please email me. I want to have all of those discussions. So the first proposed pathway program that we are looking into is essentially a CNA pipeline track, nursing assistant, or whatever you refer to your nursing assistants as. So it would be recruiting external candidates, community members to fill that certified nursing assistant role. And the reason we honed in on this is A, we all have a huge need for nursing assistants. It showed up, high on that survey. B, it's a program that a lot of you are currently doing. I also did a landscape scan on the existing pathway programs that each of your systems have created in partnership with training providers and community organizations to see what already exists that we might be able to strengthen, expand, extend beyond the existing funding that you might have for those programs. And CNA pipeline, I know, is occurring at 3, if not more, of our CHW health systems. And I know that some of the funding for those will be running out in the coming year. So this program would invest in some of our current programming. It would leverage that experience. We can take some of those strengths and keep them moving. We can talk about the challenges that those particular programs have faced and hopefully address those. And I also see this as an opportunity to really reach maximum impact and have see a strong ROI. In 3 years, I think a lot of nursing assistants could go through a program like this with the money that we have. So essentially, CHWC would be the central program development and manager. We would also put some more resources behind marketing the program. We would be doing the tracking and evaluation, whereas community organizations would be recruiting from community members, providing case management and support services. Training providers would obviously be providing the curriculum and the test prep, and then employers would be hiring. I think both employers and CHWC and perhaps some of our other partners could also invest a little bit more into career exposure growth with this pipeline. We want to make sure we're not just putting people in CNA positions and saying, great, go figure it out, your next step from there. We'd like to make sure that we are staying true to the purpose of the Good Jobs Challenge and to our collective goals here at CHWC, and exposing CNAs to their different opportunities to advance beyond CNA. So this is a program that we are discussing over the next couple of months. I have a meeting scheduled with the employers who are currently running CNA programs. If that includes you, but I haven't invited you to that meeting, please let me know. I would love to have you there. And if you have some thoughts or if you'd like to get involved with this at a later date, also feel free to email me. So that is our first idea. The second one, and I know this slide may seem a little overwhelming, but this is the one where I still have a long way to go. And this is what we started talking about at our last quarterly meeting. We started talking about, how might we upskill CNAs? What's the next logical step for them? Or how might we upskill other folks to become RNs? And it's a complicated question. So this is pathway number 2 here is the least developed, and I would love some more insight and expertise here. So, as I've been doing this research and pursuing this idea, I've come across, honed in on 3 goals for what this program would serve. Is 1, it either upskills nursing assistants or it leads to becoming an RN. So it could be upskilling a nursing assistant to a role that is not specifically nursing, or it could be upskilling someone to become an RN who is not, already in that nursing pipeline, if that makes sense. I'd like it to lead to at least a $5 an hour wage increase, if not more. And it should be achievable in 2 years or less to make sure that we can get enough people fully through the program during this grant period. So the first couple of places we were looking at is traditional nursing pipeline, a nursing assistant to a nurse. So I looked at a certified nursing assistant to an LPN. One of my concerns there is, are we hiring enough LPNs in hospitals to make this worthwhile? If you have thoughts on that, I'd love to hear from you. We could invest in certified nursing assistants becoming RNs, probably associate's degree RNs, not BSNs. My concern there is that too large of a competency leap? Do we need a lot more time than 2 years for something like that? Then could we upskill CNAs into positions that are not nursing? Sterile processing tech is one that has come up in several conversations with my steering committee, and I've done some more targeted conversations around, and it sounded exciting. But then when I pulled this data, and under each of these is the median hourly wage in Cook County from the Illinois Department of Employment Security. Excuse me. I know that some of the systems that sit on our steering committee have said, oh yeah, it would definitely be a salary increase from a CNA to a sterile processing tech, but I'm a little concerned about that. Is it a jump everywhere? Is it enough of a jump to make that worthwhile? And then another thing we've been thinking about is maybe we should start with medical assistants. You know, maybe perhaps medical assistants are more prepared to become LPNs or RNs because their training to become a medical assistant includes more focus on things like anatomy and physiology than a nursing assistant training might include. And then there are other possibilities out there, I am sure. So I know this is a little overwhelming. I want to just launch a very quick poll to see if anyone has, if we have some initial insight into what makes the most sense here out of all these things that I've listed. You know, which do we think will meet those 3 goals best, and is something that is worthwhile to pursue with our Good Jobs Challenge money. So I've launched the poll, but as you're thinking about answers to that, and I know it might be difficult to answer if you're like, that's a crazy question, feel free to ignore it. But I just welcome anyone to come off mute and share any thoughts on this before we move forward to our 3rd pathway.
Hi, April. The poll disappeared.
Oh, it did?
Yeah, I don't know if it happened. Yeah.
Relaunch poll. Do we see it now?
Yes, thank you.
Oh, I think I just immediately ended it after I launched it. Thank you, Jeremy.
Can we select multiple options on this poll?
It did not set it up to select multiple options, but what are you thinking, Jeremy? What do you
Well,
like?
I think that, well, I have two questions.
Okay.
One question. The question is, how recent is this data that you pulled from the system from Cook County?
That is a great question. I did not check that.
Because we see significant increases in compensation in the last year. I mean, sometimes even can call them ridiculous increases.
That's a really good point. Yeah. I don't know. And I couldn't figure out also, you know, the difference in medium wage for an RN with an associate's versus a BSN, which I'm sure exists. So yeah, the data, it certainly isn't perfect.
You know,
Right, 'cause we-
oh, I'm sorry, go ahead.
No. I was just going to go on the second point that I think many of these pathways make sense. But like CNA to LPN, I mean, that's a natural progression because then the LPNs can go into RN. But then, as you mentioned, the question is, what kind of demand are we seeing at our local hospitals, not only the nursing centers, right? The CNA to still processing, I think it's a valid trajectory. I mean, still processing is a career for many individuals, and it does pay more than the data you have listed, because I think, and the training is longer, and I think more recently the compensation has increased dramatically. MA to LPN, it's something to be further examined if there's significant difference, because the MA compensation has risen significantly, but I think there may be an opportunity. MA to RN, financially there's an opportunity, but I think the question for both LPN and RN, whether that's the career path of interest to them, because the responsibilities are somewhat different. Some a little bit more administrative, others a lot more patient care related. All right, I think I'm done.
No, thank you for that insight. This is exactly the kind of information I'm looking for from, and I welcome you, Jeremy, if you'd like to have another conversation and dive deeper into this. I would love to do that. Levi.
April, yeah, I was thinking about something you said. Instead of an either or, and I know you're thinking about what the hospitals need, I'm also thinking about the candidates and their individual capacity. So there might be more people that can make initially the jump from CNA to LPN some of probably a smaller group will be able to go from CNA to RN. And it may take people a little bit longer to go from LPN to RN. So let's say you have two tracks, a group with a lot of more people go CNA to LPN, smaller group CNA to RN, but then you have this other track of then the LPNs that they can become RN. And I'm not thinking about, and I know your job is like thinking about the hospital needs, but I'm thinking about the capacity and where you're getting the candidate pool. And I'm thinking about CPS students who may not have gone to the greatest high school. I'm being, me, I'm dangerously realistic about stuff and just being realistic. And then even thinking about what their life situation. And I think about someone that may have, a teenage mom, and just their time commitment. So like go from get a job that pays $18.75 to $29.71. That is for a lot of people, that is like the Jefferson. I mean, you were like moving on up to the east side. That's a huge jump. And I just think that to be realistic, think about the pool of people that you're getting and what's realistic for them.
And Dr. April, I wanted to add to the conversation. This is Dr. Conway. First, I wanted to speak on the salaries. Unfortunately, and that salary is what I've seen for permanent starting positions, I can say. And like was mentioned earlier, it is true that there are a lot higher salaries, but those are usually for those who are in a registry, or my experience anyway, as someone that has a horrific staffing issue in the Department of Corrections, I can tell you that the salaries that we are offering, or that is being offered at corrections, is somewhere around this number, which is, I think, is too low, given what the needs are and the demands of RN work. So I do see this salary, but I also agree that there are other salaries out there for those who have a little bit more experience and are able to move around. So that's where some of the differentials occur. And secondly, what I have seen, and back in my days of working in the clinics, I did see a ton of medical assistants that were interested in careers in RN. So I just wanted to share that. That's something that you will frequently hear when you're in the clinic working with your MAs. A lot of them want to be RNs. That's a frequent goal in my experience. And I also see quite a trajectory in the hospital for CNAs going to RN or CNAs going to LPN.
Yeah, thank you, Dr. Conway. That tracks with some of the things that I've heard. And so I shared the results, and I find it interesting and also exciting that so many people are on board for this, more traditional progressive pathway in nursing. Let's, get CNAs up to RN. I'm on the same page. So this has been really helpful. Unfortunately, we don't have a lot of time to keep going with this conversation, but this is just the beginning of it. I'm doing a lot of trying to research this, trying to get in front of the right people. I would love to have more conversations with folks in nursing departments at hospitals. So those who, might have some insights into whether or not you would hire LPNs, for example. I would love to talk to people about those types of questions. So please feel free to reach out to me separately or to introduce me to someone else. There's still a lot of work to be done on this particular idea.
Hi, this is Leslie from South Shore.
Sure. Go ahead.
Hospitals across Cook County, I can't speak outside of that. They are trying to hire LPNs and then have them with pharmacology, because many of us are trying to go to team nursing again because of the shortage of RNs. And so the shortage is what's driving all of the needs of how you're trying to do combinations. And so, yes, LPNs that are trained, that pass their boards are hireable. If you have 10 or 15 of them out there standing right now, I would almost tell you many of the hospitals, especially the safety net, will hire them in a heartbeat. Maybe not at the exact rates that you got out there, but they would be hireable. And so that question that you're asking is yes, they could be hired, would be hired. Now, timing is everything. There are 100,000 minimum shortage of RNs in the United States. And so there's a drastic need for the nursing profession.
Mm-hmm.
I don't know how to say it any simpler or more complex. You know,
Yeah.
was at Malcolm X graduation several months ago when the LPNs got pinned, trying to snag them to get them here at South Shore Hospital. You know, and that was my first role as the CEO. And so we're trying to get them in order to help supplement our staff. If you put an RN, LPN, and the nurses aide together, you can expand the base of patients that can be captured. It's not, you know, this is what we're trying to do. In the bigger institutes, some of the bigger ones are doing it too. You know, it used to be the small starving hospitals that only did this, but bigger ones are doing it too. I don't know if you've heard that before, but just so you understand, yes, LPNs are hireable. LPNs are hireable. Also, they're the bread and butter of nursing homes.
Right. Yeah, no, thank you for that, Leslie. And I see also, you know, Susan and Kathleen in the chat were saying, how about LPN to RN? And that makes a lot of sense as well. And I think you all will be excited to hear about OAI's nursing expansion program, in which they're going to be focused on this type of upskilling as well. So stay tuned to learn about that. Michelle, I'll go to you, but then unfortunately we do have to move on after Michelle's comment. I'd love to have this conversation all day. So please email me to talk about it more. Go ahead, Michelle.
Yeah, so I was just going to piggyback real quick, April, on what Leslie said. So yes, we certainly are hiring LPNs at Advocate, and so many of the roles that we have will utilize MAs or LPNs interchangeably. So the positions are posted to say MA or LPN, and then from an academic perspective, I do feel that going from an MA or an LPN to an RN is a shorter leap than a CNA to an RN because of the courses that someone would have to take to get into a medical assisting program, especially if they're going to a community college. To go from a CNA to an LPN could potentially take the student longer if they haven't taken any gen eds and if they don't place into college level courses when they take their placement tests. So just wanted to throw that out there. I think MA to RN might be a shorter pathway, just because a student would more than likely need to take anatomy and physiology if they're going to a community college to become a medical assistant, where CNAs don't need to do that.
Yeah, thank you, Michelle. Yeah, that also tracks with things that I've been hearing. So we do have to move on, but I would love to have this conversation with many of you. So please feel free to reach out. So we have one more proposed pathway program that we are working on, and that is in partnership with I Am Able. And I'm going to pass it over to Dr. Lamenta Conway in just a moment to talk more about who I Am Able is. But essentially this program would support folks who are on their way to becoming a doctor. They are perhaps pre-med students or in a gap year between their bachelor's and going to medical school. And as Dr. Conway shared with me, that these students, they need some clinical exposure, they need some clinical experience in order to be competitive for medical school. So I thought, what if we at CHWC, do a short-term training, something like a nursing assistant or phlebotomist, for these students, have them work with a CHWC hospital part-time for about a year. Again, this is all in draft mode. While they are getting the support that I Am Able provides, which includes mentorship, academic enrichment, MCAT prep assistance, and so we would be, meeting our immediate needs for frontline clinical positions like nursing assistants or phlebotomists, and at the same time supporting our pipeline of Black and Brown aspiring physicians. So I won't go more deeply into that. We're actually going to have an exploratory meeting about this idea in January. So if you are in a hospital, an employer who is interested in talking about this idea and helping us sort of figure out this model, then please let me know and I'll include you in that meeting. But first, I'd just like to introduce the organization I Am Able, who I think many of you already know and are already working with. But they just do a fantastic work and we're excited to partner with them through this opportunity. Dr. Conway, I'll pass it off to you.
Thank you so much, April. And it's really good to be here on today. How much time do I have? I want to be respectful of the remaining moments. I don't want to take up too much time. Just want to be able to
for that. You can take 10 minutes.
Okay, very good, very good. So I just want to tell you guys a little bit about the program, and good morning to everyone. Sorry for starting in the middle of my slideshow right there. So I'm Dr. Lamenta Conway and Sweetie Conway, and I am the founder and the executive director of I Am Able Foundation, where we are raising our next generation of healthcare heroes. The ones that want to be doctors. I'm also the deputy director or the deputy chief of health services for the Illinois Department of Corrections, our other vulnerable population. And maybe we'll be able to partner with that organization because that is an area where we really suffer in terms of getting real high quality healthcare staff into our prisons to take care of some of our very vulnerable population. The mission of I Am Able Foundation truly is to identify, engage, and curate a large pool of untapped gifts, talents, and intellect amongst our inner city youth that are underrepresented in medicine with the singular goal of raising our healthcare heroes. This right here is one of my mentees who is now a captain in the United States Army, and she's been with us for a long time. Her name is Valynn, and I remember her from her beginning of her journey all the way to her graduating from residency and then paying it back. I always say that you cannot be what you cannot see. This is my home when I was growing up in the Inglewood community, south side of Chicago. And you know, my personal experience was that I did not have a doctor of my own until I was 16 years old. That was the very first time that I saw a doctor. My very first mentor was a television character, Marcus Welby. And that was my introduction to medicine. And yet we miss so much talent in our communities because there are hidden gems everywhere. And they have no mentors and they have no guidance. And, you know, that is one of the main reasons why I started I Am Able Foundation, so that people could actually see the very expressions of themselves in medicine. I started I Am Able Foundation due to the murder of one of my cousins to Southside violence on Mother's Day. 6 months later, my cousin that is here, who was only 14, was paralyzed. And it really hit me. I thought my job in medicine, since I was lucky enough to get through, would be that I would just be that doctor, Black woman in the clinic that people, that, you know, mothers could relate to, kids could relate to. But I found that I had a larger calling, and that was to leave the door open. I think that when we think about what happened during our pandemic and how Black, brown persons were very vulnerable, and they were, you know, they were definitely more affected than most of us. We see the need, and it is a huge and heightened need for Black and brown faces within our community. This young man here, as I mentioned, was the accidental recipient of a bullet, and he ended up paralyzed. And in my conversations with him, I learned a lot about young people. And one of the things that I learned is that young people don't have mentors. And when people don't have mentors and they don't have hope, this is sometimes the end result. And that was really the beginning of I'm Able Foundation in 2015. We started our first class in 2016. And since that time, we started with 30 young people. And we are now taking anywhere from 50 to 100 students a year that continue in the pipeline all the way from wherever they might start. And the unique thing about it is they can come in their second year of high school and they can continue all the way until they become physicians. For some people, that's a shorter one, and for some people, it's longer. I'm really pleased that one of my very first students who started in 2016 as a junior is super successful in his application process right now. He's really checked off all the boxes, and he's applying to medical school right now. And I'm very, very confident because of his being a part of this program for so many years, he will definitely get into medical school without question. He's already been interviewed by places like Mayo, Northwestern, University of Chicago, University of Illinois. And this is what happens when a community gets behind kids. You get a chance to follow this from the beginning and march it all the way out to the end. And it is nothing less than incredible. I'm Abel Foundation is an overview, is a holistic organization with many parts to it. We have the Urban Bridges Medical Mentoring Program, which is our flagship program. We also have an international program where we go to study healthcare systems in other countries like Costa Rica, Cuba. My family is from Cuba, and these are some of the things that we actually explore for our young people, and they get a chance to spend summers in other countries. We have a CPR and simulation program, as I mentioned, medicine in Cuba. We also have the Chicago Health and Medical Career Citywide Student Conference, which we've held at Rush for the past 4 or 5 years. We usually have anywhere from 500 plus students who attend and their parents and families that attend that amazing event. That event is all about healthcare equity, as well as exploring careers, not just in medicine, but in pharmacy and dentistry, healthcare management, nursing, of course, and so many other careers. So it's an amazing collaborative event. We also have a pipeline program with the University of Chicago in their orthopedic program for our young people that want to become orthopedic surgeons. We have our Chicago Summer Institute for the Development of Physicians and Researchers, which are our summer programs, which are a consortium of amazing programs, including the Jesse Brown VA, where we have 2 summer programs that provide stipends to students and clinical experiences. One in mental health is going to come on board this summer, but then there's also the clinical program, which is the kids have just enjoyed absolutely thoroughly. We also have the Deal Fellowship, which is for medical students who are between their first and second year. They get a chance to work on mentoring some of the students in the Jesse Brown program, but they also get a chance to spend 15 hours a week working on an advocacy project like transgender health or correctional health care, drug addiction, re-entry. So it's really, really exciting. It's about continuing the pipeline and helping young people kind of find their space and place in society, doing social activism and community engagement. So it's so much more than medicine. It's about community engagement and making your community a better place. COVID relief projects, humanitarian relief projects. We also have a Medicine Makers program. And this last season was quite amazing. We focused on Black men in medicine and in healthcare. So had some wonderful guests, and our medical student, Kenichi Haney, who is a second-year medical student at UIC, actually was the host of that program. So these are some of our programs. I want to talk a little bit more in depth about our Urban Bridges program. And this is one of my mentees, and these are some of the students at the University of Illinois. The cool thing about the Urban Bridges program, which is our flagship program, is that it is a year-round pipeline program. Students can join anywhere, as I mentioned, from their second year in high school, and we follow them all the way up until they put on their white coats and beyond. So we don't let them go for anything. If they stick with us, we stick with them. And we offer so many things to help them stay connected to a community. I like to think of us as a mentoring community. We're not just programs, but we are a family. And I think that when you're talking about Black and brown kids who want to do something so aspirational as to become a doctor, they're really isolated. There's not a lot of people that are on that same track with them. And this gives them a family of doctors who are super close to the kids. They can call them, they can text them. They're connected to medical students as well, and just a whole bunch of parents, community volunteers. It is is a program I'd love for you guys to see in action if you ever have time. So some of the main tenets of the program is the Saturday Morning Professor series, which is our clinical education series. We are in partnership with many of the academic centers throughout the, Chicago, but especially with Northwestern, which is where we actually have our programming on Saturdays. The students spend their entire first year. So you would find that they're very strong students, and they spend their first year or 13 months learning clinical history taking. They also do journal club, biostats, and all sorts of things that are public health related. So that first year is a very intense year. But when they finish that first year, they are really, really well versed on understanding things like, for example, is Paxlovid a good medication for COVID treatment? So they explore these articles, they learn how to critically review and analyze the data that's out there. So these are really great opportunities for these kids. They also, when they finish this first year, know how to write a complete history, medical history for a patient. So they actually have a mock clinical history taking competition where the kids become the doctor, and then the doctors become the patient, and they have to write it up and present it as they would in a medical chart. So these kids are often who have often gone on to become scribes, something that's often needed in our ERs and things like that. They go in there completely ready to take care of patients alongside a doctor, of course. So Saturday Morning Professor, that's kind of like an overview. Once the students finish their first year, they then are able to go into what we call advanced tracks. And these have been almost exclusively run by Northwestern. Students can choose a track in GI, gastroenterology, where they're learning about scoping, endoscopies, polypectomies, and actually get their hands on the equipment. They can do 6 months of cardiology. We have students who are actually able to read EKGs. And if you put an EKG of someone who had inferior wall infarct, they can actually read and say, this patient had an anterior wall or inferior wall infarct. I feel that if you set the bar high enough, students can actually reach that bar. You just have to set it high enough. And these are high school students, some of them, that are reading these EKGs. So it is absolutely amazing. These kids are super motivated, super bright. And when you present all of this learning, they are thirsty for it. They stay after the program is over. That's how much they actually enjoy what we're doing. They don't leave when it's over. They're always sticking around, hanging around and talking to the doctors. So I mentioned GI, cardiology. We have a pediatrics curriculum. We're working on a pathology curriculum, which I think is going to be absolutely amazing. Physical diagnosis. And I know that I'm missing a few. We have quite a few programs. So the kids can continue through the program. The pipeline keeps going. Every 6 months, they can choose something different. They get new mentors. They get a chance to learn more. We also offer academic advising, because we know that many times, I think all of us on this call have probably experienced someone telling us what we couldn't do when we are in college and saying, oh no, you can't be a doctor. Oh no, you can't be a nurse. And this is an opportunity for us to preemptively strike and let them know you can do anything. There are no limits to what you can do. You just simply need to know what the cost is going to be. And I mean the emotional, the mental, and the physical cost of fighting through something that you really want to do. So we spend a lot of time giving them the kinds of things that they don't get sometimes in college. There's also one-to-one physician and medical school mentoring. Every kid is partnered one-to-one with a physician and medical student mentor. And this year, we also are now partnering our kids with other kids that are in I Am Able Foundation. So kids are now partnered 3-to-1. We have small mentoring circles. We have humanitarian outreach programs. We have lots of mentor-mentee events, so the kids feel very connected to the faculty who have been working with us. The kids are a part of professional conferences. And even after the first year, students actually participate in our symposium, where they can actually present research projects or things that they've learned throughout that first year. And this is just talking about a little bit of what I mentioned before about the Saturday Morning Professor and the 13-month first year curriculum, and some of the programs. We now have some new ones now. It's very rigorous. And why do we do all of this? Why are we teaching kids clinical skills and they're not doctors? It is because of what we all know. It's legacy. It's creating legacy by proxy. These are the things that we take for granted, or that people or communities take for granted when they have parents that are doctors or parents that are engineers. They're the subtle conversations that happen at the dinner table that don't happen with these kids. So they don't have parents. Most of these kids are first generation. So they don't have parents in medicine, in nursing or medicine. And many of them are first generation college students. So what are we doing? We're creating a legacy by proxy, where they're learning the language of medicine so that they don't feel like they're imposters in this world. They feel comfortable, they can talk about it. And so then as they get closer to their goal, they realize that they can actually fit in. So it has been an absolutely wonderful experience. We talked about the intro to history taking, the advanced curriculum. We have several new ones now. And some of the program features is rigorous, preclinical curriculum. The kids love it. As I mentioned, they learn the language of medicine. They're mentored by world-class academic clinical educators. And it was virtual, but now we're completely back in person at Northwestern.
Dr. Conway.
Yes.
Oh, so fantastic. We do have to wrap it up, though. I just want to make sure I give enough time to our last two presenters.
No worries.
I know everyone is all very excited about everything that you do, and I'm so excited we're partnering with you at CHWC.
No worries.
And I will send all of Dr. Conway's slides out to everyone. Sorry too. Oh, I mean, you can still have another minute or so, Dr. Conway.
Oh, well, I tell you what, no worries. Thank you, April.
Yeah.
I didn't want to hold people up, and I didn't know how much time, because I get really excited talking about this, and I wasn't sure where I was. But I will say this: one of the things that we that is a requirement for medical school, it's kind of gotten impossible for these young people. And just think about it. In order to get it, some of these medical schools, and this was true when I applied to Rush for the third time back in the early 90s. There were 17,000 people kids and students that applied for only 120 seats. So it's rough, and there's a lot of criteria that you have to scratch off the box. Getting around to what April said, one of the things they want is a strong academic portfolio that we work on, making sure that the kids know what the requirements are early on. So like a 3.5 or higher GPA. The second thing that students need, they say that it's not important, but they don't take people who don't have good MCATs. It's just the truth. And so we have the MCAT summer intensive program where we have actually seen some of our students scoring in the 90th percentile, kids that started somewhere in the 30th and the 40th percentile at the beginning of their MCAT intensive. We actually got a chance to watch 8 of our I'm Able Foundation mentees get accepted into medical schools all over the country this year. So the program is definitely working, and it's such a blessing. But that's MCAT. The third thing students have to have is research experience, ideally, especially if they want to go to schools like Northwestern or University of Chicago, Mayo, or other research-related schools. But the fourth thing that they need, and I think this is a lot to ask of any one student who's trying to actually go to medical school, is clinical experience. And this is the toughest one for most of our students, because getting past places where doctors feel like they can bring in students is the challenge. So one of the things that medical schools are asking is, what kind of clinical experience do you have? How do you know you want to be a doctor? What do you know about medicine? So one of our ideas that we had many years ago, and I think it was just waiting for its time to reveal itself, was to provide short-term opportunities for these young people, where they would get a chance to, at least say that, hey, I've done EMT work, I've been a phlebotomist, I was a medical assistant, I was a CNA, and those types of things. Short training programs, as April described, something that may take 3 months or 6 months, or even up to a year, depending on how long students may wish to be in a gap year. Many of our students, for financial reasons or just so many different reasons, can't go directly to medical school, or they're on their own and they don't have a lot of financial support. Once they graduate from college, they are just out of the nest, and they need a way to support themselves. We have a lot of kids that are out there by themselves, and having a good, decent job that they can actually be a part of or participate in while they're studying for MCAT is great. I think the value to some of you that are here is that you're going to get smart students who are extremely motivated, love medicine, love things that are clinical. And so you're going to get a high quality student. The other thing is these students know that, you know, this is something that's going to help shape their career, and they get a chance to, actually, we all get a chance to produce better doctors, because I do believe that one of the problems with medicine is we have a lot of physicians that just don't understand what it's like to provide healthcare at the most basic intersection of patient need. So when a person is out there and they have an accident and EMT show up, that is something that doctors need to understand, how patients present out in the field. How do patients present when they're in the room and they can't, you know, help get themselves to the bathroom or can't walk without assistance? Doctors need to know those things. I think we create better doctors by making sure that they have some exposure to other areas of healthcare and great respect for other areas of healthcare. So April has already described what the idea of the program is and what we envision. And that, again, is to provide opportunities for pre-med students to have maybe a year or two, or maybe even more, working in a healthcare area before they transition off to medical school. And I'll stop right there so that you guys can move on, because I know you have got a lot on your agenda, but I'd love to talk to anyone, you know, about any information that you might want to know about I Am Able Foundation and all the tons of stuff that we do, as well as this healthcare initiative that we are envisioning.
Thank you so much.
So
Dr.
much, April.
Conway. Yeah, unfortunately, I tend to do this, y'all who have been on meetings with me before. I like to pack it in, and so we're behind schedule, so we don't really have time for questions. But Dr. Conway, if you could put your email in the chat.
I will. Thank you so much.
Thank you, and we're excited to partner with you. So anyone who's interested in partnering on that program, let me know, and I'll include you in our first exploratory meeting. With that, I'm going to pass it. We have 2 more presentations. We will not have enough time for community announcements. So if anyone has something they want to share, feel free to put it in the chat. But I'm going to pass it off to Molly Dowling from OAI, who is working on a nursing expansion program. And then we have 1 more after her. So stay with us, everybody.
Great. Thank you so much, April. Really happy to be here today and so grateful for the opportunity to talk with this group. Thanks for that great presentation, Dr. Conway, and April for the overview of the grant. What I'm about to share with you really aligns well with what's going to be happening with the Good Jobs Challenge initiative. By way of background, OAI, I am the executive director of OAI, and we are a not-for-profit workforce development organization headquartered in Chicago with a satellite in the south suburbs. Our mission is to offer skills training that leads to safe, meaningful employment and helps companies and communities to thrive. And we have been doing work in healthcare for many years, helping to support folks from non-traditional backgrounds get exposed to careers in healthcare and then to continue along career pathways in the field. Along the way, we've developed many partnerships that have brought us to this moment and the opportunity at hand, which is to apply to another large Department of Labor grant called the Chicagoland Nursing Expansion Program. The grant that we are putting together is due next month, and it is again to the Department of Labor, and it is a 5-year opportunity, which is kind of amazing because it is going to allow us to help serve many folks in our region. But I'm just going to take a few minutes to run you through what this is all about. And really the ask that I'm going to make at the end is about your interest in being involved. From the hospital or healthcare employer perspective, we would love you to sign on with us. If you are facing a worker shortage in nursing, we believe that this will be able to help you in the long term. So just be listening for that. And I will run through the specifics very quickly because I know we're short on time. I am also joined today by my colleagues, Dr. Sandra Dafiagor, who leads our Southland department, where all of our healthcare programming lives, as well as our program manager, Zhao Fan Liu. So this initiative aims to train 300 frontline healthcare professionals over the 5-year period. The whole goal is that they would advance along a career pathway, attain post-secondary credentials needed for middle to high school nursing occupations. So this is right in line with that conversation about that progressive pathway approach, which I'm going to speak to a little more in just a second. Again, it's a 5-year period from 2023 to 2027. So there's an opportunity in that time to really holistically support someone from the beginning of their pathway to the end. Now, as we move through, get to second and third year of that period, we would be talking, and because the end goal is really to produce nurses, we would then be talking about, the middle entry point, LPNs to RNs and RNs to BSNs. The other goals of the grant program, including enhancing job quality within the sector, supporting healthcare businesses to invest in the nurse preceptor role, making sure there's plenty of support on the clinical site for these new nurses as they learn, and ensuring commitment to diversity, equity, and inclusion and accessibility for all participants. And I know that is a core value that the folks in this group hold. And then, of course, we want to create pathways of economic prosperity for historically marginalized groups. So making sure that folks from lots of different backgrounds have access to these career opportunities. So again, this progressive pathway approach means thinking about every step along the way, not just one CNA to LPN or LVN, but also then from that step to RN and ultimately to the Bachelor of Science in Nursing or other advanced nursing occupations. So we're partnering with a number of training entities, so private training organizations, community colleges, and Governor State University, so that we can support folks all along this pathway, not just with tuition assistance, but also with all the supplementary supports we know are necessary for retention and ultimate completion. This is a huge partnership approach. So some of our partners are even on the call today, and we are actively recruiting others, but they include, of course, this group, the Healthcare Workforce Collaborative, as well as Instituto del Progreso Latino. They not only as a nonprofit workforce provider, do some of the supports that OAI does, but they also have their own college, Instituto College. We're partnering with Governor State University that offers the RN to BSN track. Many community colleges throughout the region, both on the Illinois side and in Indiana. Private training providers, especially at the CNA level. The Chicago Cook Workforce Partnership, we will be leveraging plenty of WIOA dollars and definitely partnering with folks involved in the Good Jobs Challenge grant and the many training providers there. SEIU as a labor union representing healthcare workers, DCEO and its Office of Apprenticeship. OAI has built out an apprenticeship for advanced CNAs, and we know other organizations have as well, so we'll be promoting that where applicable. Women Employed as not only supporting healthcare training programs, but also a worker voice advocacy organization, and LISC Chicago, which helps support many of us to provide financial opportunity center supports, including financial coaching to everyone we serve. So you can see there's a huge ecosystem of folks involved in this. And as I mentioned at the top, the ask for you today is companies that are interested in signing on. We have a number of hospitals that have already expressed interest, and we are looking for more. So if this is, because of your involvement here, if you've in this group and you are experiencing a workforce shortage, this is just yet another program and resource that can benefit you. So we would love to have your support. The more support we get, the more likely we are to be funded. And all of us collectively will be working together on this initiative over the next 5 years. This list is some of the bullets we're asking of employer partners to sign on to. If you're interested, we would send you a draft letter for you to review, edit as you saw fit, and then return to us. Of course, we are asking that you ensure DEI are central to all of your hiring. I won't read all of these bullets, you can read them yourself, but we want you to provide leadership, but participation in this group is exactly what we're looking for. We hope that you will provide good wages for the folks that you hire, which I know you have to do to be competitive anyway, and help support your workers to progress along their own career pathway. So we would also be interested in supporting your incumbent workers to enroll in the program and offer the support services that the grant will fund. So that is the quick presentation that we wanted to offer today, April. So again, I'm Molly Dowling. I lead OAI. I am joined by Sandra and Zhao Fan, who are also on today's meeting. We are looking for you as employer partners to help sign on to this initiative. And if it's interesting to you and you think you'd like to be involved, you can chat us. We'll put our emails in the chat. You can also ping April afterwards. She's been so gracious to help connect us with many of you already. But if you haven't heard about this and you'd like to see the executive summary with more details about who's involved, what the funds are going to go to, we're happy to share that with you as well. So I'll stop there, April, in spirit of making sure we have enough time for everybody. And if there are any questions, happy to entertain them.
Thank you so much, Molly. Yes, thanks for keeping it brief. I gotta work on my scheduling here. This always happens to me. But everyone, I know we're all interested in this work, so reach out to Molly, reach out to me. I'll also include that executive summary in our newsletter in a couple of days with all of this material, including those slides. If OAI is awarded the grant, there are more opportunities to join and to learn about that into the future, but they're most likely to get it if they have a lot of employer letters. So sign on now. With that, I'm going to pass it off to Megan Phillip from Healthcare Council of Chicago to talk about their Future of Work series. That will conclude our meeting for the day. I will be sending out all of this information in a newsletter, like I said. I'm going to drop my email in the chat right now as well. If there's anything, send me a note today saying, this is something that I'm really interested in talking to you about from today's meeting, and I'll make sure to follow up with you. So thanks, Megan. Go ahead.
Do you guys see the presenter view or the slide view?
The slide
Okay.
view. Yeah.
Okay. Just really quick, my name is Megan Phillip. I'm the Executive Director of the Healthcare Council of Chicago, which is actually an initiative of Third Horizon Strategies. For those of you that aren't aware, the Healthcare Council of Chicago is a collaborative of healthcare organizations across business and providers, really bringing a cross-section of ideas to address areas of interest. So I will let you just kind of look back at these slides and go to our website. Here's just a quick list of all of our members, and I would love to talk to you all if you're not involved with us in other ways that we partner. But the thing that we wanted to share is what Michelle shared at the beginning of today. She was so gracious to join us on a Monday morning yesterday for the kickoff of our Future of Work series. So one of the primary things that HC3 does is a lot of convening and thought leadership. So we have been identifying several topic areas under the umbrella of workforce to talk about, to be able to share and have opportunities for cross-sectoral opportunities to look at specifically the healthcare industry, but always have a diversity of thought. So as Michelle mentioned, we were gracefully able to intertwine her amazing experience with Advocate Aurora with our other member, Alight Solutions, which focuses on benefits and actually works across industries. So it's really great because a lot of these programs will have sort of a healthcare bent, but also have different perspectives. The list here is several ideas that we have for 2023. This is not exhaustive. We are very much fluid, and I'm always looking for other partners. Several of you that presented today will be hearing from me to talk to some of these ideas. So I welcome anybody that wants to be involved and partner on any of the events that we have or other topics that we might be able to explore together. I also am in the process of putting up a recap of yesterday's event. It's been a busy 24 hours since yesterday. So if you visit our website later under Insights, you can check out that, and I'm sure it might get shared via April and other future things. Here is my information, www.hc3.health, to learn more about what we do and other events we have coming up. So feel free to reach out, check out our website, reach out to April, and she can connect you to me as well. So thank you.
Wow, thanks, Megan. And I apologize.
No, it makes it easier. I won't linger.
Good. Well, as I said to Megan in the chat, I'd love to invite her back, perhaps for our March quarterly to share some insights from that series. Yeah, this week's newsletter is going to be hefty with lots of different opportunities. So please look out for it. Please forward it to your colleagues. There's so many opportunities to engage in these learning events, to sign on to OAI's nursing expansion program, or to get more involved in our planning with our Good Jobs Challenge money. Again, I'd love to hear your insights. And with that, we have 3 minutes. Does anyone have a community announcement to share? Or a question for Molly or for Megan?
Hey, April, it's Mary with Midwestern Career College. Just real quick, I want to share with everybody that we are actively moving forward with developing and implementing an LPN program. I know there was a lot of talk in today's meeting about that, so I wanted to make sure everybody was aware about that. I'm going to put my email address in the chat. I would love to have conversations about this, and great content today. Thank you so much.
Thanks, Mary. Yeah, that's great to know that you're moving forward on that. I know that was in the pipeline. Anybody else? Okay, well, thank you all for joining today. I know this was a packed agenda. I appreciate all of your attention. Have a wonderful holiday season. We'll see you in 2023. And again, look out for that newsletter. It's going to be packed full of good information. Thanks, everyone. Bye.
See ya. Bye-bye.
Thank you.